Thank you so much, Lena. Good morning, everyone. Thank you so much for joining us here today. We are here to share with you comprehensive suicide prevention practices and the policies around them and why they exist and what we need to cover. So we have a lot of information and not that much time, so we'll go ahead and get started. I'm Mara Madrigal-Weiss, and with me is Heather Namor, and we will be your facilitators this morning. Heather, next slide, please. So what we'll be talking about today is the prevalence and trends that we're seeing around youth suicide. We were already having issues prior to COVID. We anticipate, just based on what historical data indicates, is that when there is a national pandemic or any stressor that affects us collectively, oftentimes we will see suicide rates grow. We also want to understand how current legislation on suicide prevention plays out in our schools and know where to access the resources. So we've spent a lot of time in this area, and so we have reviewed the resources and really just made it easy for you to access them. So you will get a copy of these slides and they will have access to all the links. So just know that as we continue. So next slide, please, Heather. So some of the data and trends, we can go ahead. Thank you. So youth suicide in the US is the second leading cause of death for ages 10 to 24. And we know that 50% of students ages 14 and older with a mental health illness drop out of high school, and almost 4,000 people ages 14 to 25 will die by suicide. 24 will die by suicide in the United States annually. Over 90% of youth who die by suicide have a mental health disorder. So it's not just one thing that happens. There's multiple factors that play in. So Heather, if you can go to the next slide, please. So as you can see here, the national data indicates that suicide rates have been steadily going up since about 2007. And so it's something that we need to address. It's something that we have gotten better at addressing, and it's something that we need to be ready to ensure that we have the right policies and the action. So policies are just policies on paper or electronically. We have to put them into action because it is the difference between one of our students dying by suicide or not. So it's so important that we do this. Next slide, please, Heather. So what we know, what the data also indicates, is that many issues relate to a child who dies by suicide. It's not just that one thing, like I mentioned, that's the tipping point. In fact, there are multiple factors. What is important to note here is that overwhelmingly, students who died by suicide had issues going on at school, whether it be academically or socially. There was an argument or conflict close to the time that they died. Intimate partner problems, so boyfriend-girlfriend issues, and family relationship problems. So what we know now as well with the pandemic is that many of our families are struggling in so many different ways. And so it's something to take note of if students report these things happening. Also just the difficult nature in which we're practicing at school, where the virtual environment has really changed so many things. Many of our students report that they're struggling with that. So take all these things into considerations, because right now there's a lot of stressors on our students, and we want to be able to recognize a student who might be struggling with suicidal ideation. Next slide, please, Heather. The San Diego, California Healthy Kids Survey, we got the latest report, which reports the numbers from 2017 to 2019. And so what we see here is that in the past 12 months, so the question is, have you experienced chronic sadness? And during the past 12 months, did you ever feel so sad or hopeless almost every day for 2 weeks? And just look at the numbers. This is just for San Diego County. So for our 7th grade, okay, well, let me talk about our 9th and 11th graders, right? We see that they're going up compared to the last set of data, which was in 15-17. And this is the first year that we asked the question of our 7th graders. So for 29% of our 7th graders to report that they're feeling chronic sadness, very concerned about that, and also the suicidal ideation. So we see the numbers are 15% of those students who took the survey are reporting suicidal ideation. So again,
Mara, the 7th grade, the new question is for suicide only.
Oh, sorry. Thank you. Mm-hmm. Okay, so I'm getting terrible feedback on this. Sorry. So again, just important to note, we wanted to share those numbers with you so that you're aware of what we're seeing in our county. And so with that, Heather, you're up.
Thank you. And something we always like to remind folks is that it's so important to look at your own data around your district, what your students are saying around the CHICS data, and help that inform your programming going forward. So in the context of everything we're sharing today, having that data for your own specific district is really helpful in building your policies. Okay, so we're going to really just break down the various legislations that relate to suicide prevention in schools. And a lot of time with legislation, there's confusion and really not having a strong sense of how does this really play out at in the school level in our day-to-day practice with students. So we're going to try to break it down and then align it with resources to support districts in meeting the requirements of the legislation. So the first one is AB 2246, which this was passed in the 2016-17 school year. And it's very much alive and well, because a part of this legislation is annual things that you're doing. So we'll be looking at that. But the rationale for 2246, how it all came about, is realizing that children and teens really spend the majority of their day in the school. And the people that interact with them in the school setting are really the ones that are primed to notice what some warning signs of suicide and be able to make those appropriate referrals. So schools being so well positioned to really be that those eyes and ears on our students so we can be preventative. So that's the rationale for 2246. And really breaking down what is it, what are the provisions, and what does this look like in your school community? So first, the districts need to develop and maintain a suicide prevention policy. And it needs to include prevention, intervention, and postvention. And that often can be a challenge for districts, because we put a lot of focus on intervention and prevention, but we don't like to think of the postvention piece so much. But it's so important that we think that through and have postvention plans in place. So in the unfortunate case that a student dies by suicide, we know what our protocols and procedures are going to be, instead of flurrying around trying to get the resources in that moment. So also the policy needs to specifically address the needs of high-risk groups. And we'll go into that in another slide of what those groups are. And we don't like to use the term high risk, and there's even legislation that is removing that language from school documents. And we now can say at promise or high priority youth. And then the policy should state how staff will be trained each year. So again, thinking about our policies in an annual way, like what the trainings and resources that are available to your districts might be changing each year. So you want to be updating that. And then identifying mental health services and when and how to refer youth and their families to those services. So really having a sense of services that are available in the school and in the community through our partners that we have. So we want to at least identify 2 staff members that are the primary kind of go-to if there is a student that is having suicide ideation. And so ideally you want a minimum of 2 go-to people, whether it's at the district or the school level, but identifying those key staff. And then the referral process should really be something that all staff are aware of. How do I refer? What is the process if there is a crisis or we need to get students connected to school or community resources? And then those people that are the go-to that are conducting the suicide risk assessments, we want to make sure that they get that professional development training, whether it be employed mental health professionals, the school nurses, the counselors, and so forth. So this slide is really an example of what a competent suicide prevention policy looks like in a school community. And the key thing is, everything we do around suicide prevention is we want to build protective factors so we can buffer all of those risk factors that our students are facing. And so you can see the different tiers here. So the first one on the bottom is really, administrative policies and protocols reflect engagement with the larger community. So thinking about our students, yes, they're at school all day, and that's where they are most of the day, or now on Zoom classes, but they are members of a much larger community than just school. So be thinking about the larger context of the school community. How do we engage not just our school people, but also our community partners as well? And then the second one, awareness in services for faculty, staff, parent resource, activities, materials, student curriculum. So this is really about sharing that same message with staff, students, and parents. So everybody has a common language, we're on the same page, we're creating a web of support for our students. And also when we think about professional development and training staff, we don't always think about our classified staff and how critically important it is to increase the mental health literacy of all, because often it's the school custodian, the secretaries that have the better relationships with the students. So the more that are trained and aware, the better. And then we have the intervention and assessment tools. So this is really the assessment tools using, ideally we want to use evidence-based tools that are shared across the district. And we're in the process of surveying our districts across the county around what are their practices in suicide prevention, intervention, and postvention. And we're still in the process of collecting data, but what's really interesting so far is that almost half of our respondents are saying they created their own tool. So we'll talk more about suicide risk assessments a little bit later. And then the last part is just making sure those protocols are in place that address postvention and crisis intervention and not just focus on prevention, of course. So this, again, is just showing the continuum of how training and education is so important, not just, again, for our staff, but really best practice training the whole school community. So the more people that learn the warning signs of suicide and how to intervene, the stronger the prevention will be. And we'll be sharing tools and resources that will help build comprehensive practices in place for all three. And what's really critically important right now is that we are really taking the opportunity to make the students the ambassadors and champions around mental health and prevention, and providing that peer support that is actually needed and also preferred by students. Oh, and then quickly, just when we think of our protocols and policies and procedures, again, we're thinking not just prevention, but what does it look like in intervention and then postvention with the whole school community. All right, and so there are policies that are available for use. Some are as a model policy and example policies. So CDE has a model policy in place that is very lengthy and it's really meant to kind of be a guide to polling what is relevant for your school community and what are some exemplary practices that you can embed into your suicide prevention policies when you're building them. The Trevor Project also has a model policy as well. So those are two great go-tos. And then the California School Board Association has a sample policy. It's much shorter. It's not the ideal policy, but if you're looking for something that I need a 2-pager, give me an example, that's a good one as well. And just to mention, the CDE model policy right now is being redone and is going to hopefully be available in early March. Okay. Still me, right, Mana? All right, so the Suicide Prevention Resource Guide for Schools, this was developed in response to years ago, many districts saying, they're scrambling to find resources. There's so much out there, and we know that schools and districts don't have the time to go out there and sift through what is relevant, what is best practice, what's evidence practice for schools. And so in partnership with the Suicide Prevention Council that we participate in through the Education Subcommittee, we developed this guide. And it's really, you can see here on the slide, the different areas that it breaks down to, but on the left, there are local resources, and on the right, there are national resources. So if you are looking for a curriculum for students, you can find it in here. If you're just looking for some helplines or crisis lines, or what are some good apps to share with students, it's all in here broken down in a very easy to use way. And something we added, we update this each year. This year we added legislations in there so that you can have links in there as well to get more information. So this is a very comprehensive guide. We want to make sure all districts and schools have this, and this has been uploaded in the conference site. So in order to support, going back to the policy, and a part of that here, you can see on the left that it needs to address those high priority groups. So you can see some of the examples here on the left that they call out. So what our office did to support districts to meet these requirements, because it is often challenging to find specific resources for specific youth groups around suicide. And so we have done that, and we've broken it down by the youth group on the first column. So it might be in there, students with suicide attempt survivors or Native American population, specific ones that are called out. And then in there, it just gives you the name of the resource, a brief description, and then the link to get to that resource. And this is something that's really meant to share with families and students themselves. So this again is uploaded on the conference site. All right, Mara.
Okay, I got you before you said you're on mute. So the Policy to Practice Toolkit is something that we put together based on all the resources that are out there. So there's so many different links as Heather shared with you, and it's important to know where those are all at. What we did with this Policy to Practice Toolkit is just combining from what we thought were some of the best materials out there and that meet the policy standards. So you will have access to the protocol for suicide intervention, documents highlighting student safety plans, also the Columbia Suicide Severity Rating Scale, and we'll talk more about that. Action plans, parent acknowledge forms. Instead of having to redesign one, this one has all the information necessary, as well as tips for parents in multiple languages. And then there's the Handle with Care memo, which is just a notification to anybody that might be working with a student who either experienced suicidal ideation, lost a friend to suicide, something going on. It's just a memo. It doesn't give details, but it just shares handle the student with care. Something's going on in their life, something's happening. So just take note that they might be experiencing challenges while they're in the classroom or along the school day. And then a web of support diagram, which is very important just to help students identify there's different levels of support, informational, emotional, practical, and it helps them outline different people, different resources, different strategies that they can implement when they're feeling that they're really struggling. So that's just kind of in a nutshell what is included within the Policy to Practice Toolkit. And again, when you get copies of these slides, you will have access to the full toolkit. So just to break down that a little bit further, I want to talk about, next slide, please, Heather. The suicide risk assessment that we have included in that toolkit for schools includes the Columbia Severity Rating Scale. And there's many suicide risk assessments. Why we share this one is because here in San Diego County, law enforcement, county behavioral health, many of our community-based organizations are going towards this one. And it's evidence-based, it's practical, it's easy to use, and there's an online training for approximately 30 minutes that you can share with your staff. It's all free, so the training is free. You just log on to the site and everybody can be on the same page about how to use the tool, and then you can have discussions around what does it look like after we use the tools and all the next steps. So we just mentioned it here, the Columbia Severity Rating Scale. Ideally, we get to a place where we're all using the same tool. What we have found in working with school districts is that many times some of our counselors will bring what they got during their program as they were getting their credentials. And then you have what the district created maybe 5 years ago. And so it's just one idea of getting us all on the same page. So next slide, please, Heather. I'm sorry, and let me just, I should have said this earlier. When you look at the toolkit and the resources within the toolkit, all of the documents are highlighted based on severity level. So you see the yellow, the orange, and the red. And so you would really follow that same guide as you look through the toolkit, and the resources will be aligned based on severity level. So sorry, Heather, we can go back. So example of template tools, again, the action plan. So if you see here, it's yellow, determine low risk. There would be others for other risk levels, student safety plan. And again, just taking from best examples out there, everything put together is we ensured that it does follow best practices and that the resources are evidence-based. So we wanted you to just have that available to you. And then parent resources. So we can't do anything without supporting our parents through this. What do they need to know? Know the signs. I'm sure many of you are already aware of this resource. They do provide resources in multiple languages, which is really helpful for our parents, and just lets them know, questions that they should be asking themselves, how to reach out, who to reach out to. There's the suicide prevention hotline is on there where they can get resources. So just a wealth of resources for parents. And then the National Association of School Psychologists has a wonderful tip sheet for parents, very helpful as well. So that could be something that we give to parents who we have students of they're dealing with concerns. So all this, again, just wanted to share with you some samples of what is in the tool guide. And then next slide, please, Heather. As Heather mentioned, postvention, this is where we also find a big, some missing links when we work with our school districts around postvention resources. It's so important that we get ahead of this prior to having a student die by suicide. So just really getting familiar with it. The one on the left comes from the Suicide Prevention Resource Center, and that was designed by a host of different agencies coming together to develop that. And then the resource on the right comes from the SAMHSA model, which is an entire book, basically. And in chapter 3, they highlight all of the postvention resources and a wonderful checklist of things that you really need to address if a student dies by suicide. So that's a great resource. And again, you'll have that provided in the link that we share with the entire resource guide. And then next slide, please, Heather. And then finally, peer-led suicide prevention. What we have found since, we were doing a lot of work at the state level and with our districts here, and what we have found is the students are asking for the information. It's becoming this big movement with the youth. We had students who were very interested in mental health and wellness before, and now with everything that's been going on with the pandemic and the other social epidemics that we're experiencing, they want the information. They want to be able to support one another. What we found too is that early on during the pandemic, what schools, what districts, what county offices did is we created the resources for parents. We went to what we know. Hurry up, let's get resources for mental health and wellness out to the parents. And what we heard loud and clear from our students was that their parents weren't able to address anything other than basic survival skills. And so to make this huge assumption that if we just provide the resources to our parents, then everything would be fine was a big miss. It's how do we get the information to our students? So we created a youth mental health guide. And again, with that same thought in mind is peers want to lead the work. And so these are some of the best programs out there for peer-led suicide prevention. The Sandy Hook Promise, Living Works we'll talk more about. Cognito is an online program that has avatars that you work through. More Than Sad is curriculum that can be delivered in the schools. NAMI on Campus, they will train a group of students, an advisor. They need an advisor to work with them to have like a club around mental health and wellness. Directing Change, and then teen mental health. Sorry, first aid.
You're on mute, Mata. Are you okay? You want me to pick up? So teen mental health first aid is something that came out of the National Council for Behavioral Health, and we're trainers in youth mental health first aid, adult mental health first aid, and they through Lady Gaga Foundation, they now she really drove the work around this, have a teen mental health first aid where students actually get to be well, an advisor from the school, a couple advisors from the school ideally go get trained, and then they train student leaders who then provide 20, 25-minute trainings in the classroom to students. So it's the students training the other students around mental health literacy, and really kind of normalizing having that conversation around mental health on the campus. And when the students are leading that effort, what they find is it really gains traction among students on the campus, because again, it is peer led. So Teen Mental Health First Aid, all of these are links to the resources. Our Mental Health America is leading kind of the local work around this. So the link takes you to that to find out how to apply to have that at your school site. And a part of that too is staff are I think you need 10% of your staff trained in teen and youth mental health first aid. So it kind of all interlinks with each other. So you're getting everybody on the same language around that. And so all these resources are available by just clicking on the link. Okay, well, that was good timing, Mata. Anything else you want to say?
I know. Thank you, Heather. No, that was it. I'm sorry. I just started coughing.
Yeah, it happened.
We're good. You're up.
Sure, you have that water there.
I know. It's just coffee.
Okay, so the next legislation, that was a lot on 2246. So this is really still in line with AB 2246, where this was passed this school year. AB 1767 essentially says that we're expanding AB 2246 to the grades 1 through 6. And, Mona and I were especially thrilled about this because we do a lot of work around the county and the state in informing policy recommendations around mental health in schools. And one thing that we have known for a long time is that all of the legislation focuses on middle and high school. And what we know from the very little data that we have is that, as you guys know this more than us, students are experiencing suicide ideation at as low as kindergarten, so all the way through the elementary grades. So now we have this policy in place where K-6 LEAs need to also have a suicide prevention policy in place that addresses prevention, intervention, and postvention. And, one of the, another reason close to home for us that this is exciting is because we have been doing a pilot project across our county the last couple of years, and we have several districts participating, and we have asked them to share data around the number of suicide risk assessments they complete, the severity level, the grade level, the ethnicity, and the gender. And the sample data that we have is so compelling because out of the participating districts, the elementary ones have the highest number of suicide risk assessments being completed. So I think that's just like a sample data gives us a sense of how prevalent this is in the younger years. So we really need to get ahead of it and be in prevention, and by doing that, get suicide prevention policies and protocols and procedures in place at the elementary level. So 1767, as I was saying earlier, CDE is updating their model policy. A part of it is to make it current. And as a part of that, they're going to have a separate section that's a model policy for what an elementary suicide prevention policy would look like, which looks pretty different than middle and high school. So there'll soon be a model policy to follow from that. So in order to support our districts in meeting the requirements of AB 1767, we created another resource guide. And we just did a lot of research and finding out what already exists out there around training and curriculum for suicide prevention that is age appropriate for elementary school. There's not a lot out there, but what we did find that's evidence-based, we put it in here. And so you'll be able to find what are the opportunities to train staff around suicide prevention in an age appropriate way. There's also a couple of really interesting articles around what suicide prevention looks like at the elementary school level, because this is new for us. And then a lot of what it does look like, and the research focuses on, is resiliency and SEL. So there are resources in there in relation to resiliency as a suicide prevention protective factor, and how social emotional learning is really a big part of this. And, you know, as you guys know, being able to teach our students how to identify their emotions, how to regulate, how to self-regulate, how to co-regulate, all of that. So this is just a comprehensive guide for what is currently out there. It's something we'll probably update on an annual basis, because this is starting to grow suicide prevention elementary school with resources. So this again is loaded on the conference website for you to have at your ease. So AB 1808 also passed this year, and last year, I should say. And this is really about legislation that came with funding attached to it to provide access to middle and high school staff and students for an online suicide prevention training. And so through AB 1808, it's not a requirement you have to meet. What it is it's legislation with funding that makes an online suicide prevention training available. This can be an option to help districts meet the requirements of AB 2246. So in thinking about how am I going to train how are we going to train all our staff this year, LivingWorks START, which is the online training we'll be talking about right now, could be an option to meet that requirement. So our office, San Diego County Office of Education, applied and received the grant to be the lead in the state to provide access to the training. So CDE contracted LivingWorks to provide the online suicide prevention training, and we have been working furiously to get this rolled out across the state. So we're excited to share with you this opportunity, because with the training, one user that clicks on and takes the training, whether it's a staff or student, that's a user license. So we have a certain number of licenses available throughout the state, and due to the multiple challenges of distance learning and the pandemic and all of the multiple challenges schools are facing right now, it's got a late start. So we are offering this training for all middle and high schools in San Diego County that are interested in getting staff and students trained. And so we have this flyer that's also uploaded on the conference website. And the flyer is a really easy way to share it far and wide within your school communities with your staff and students. This middle part, all you do is you click on here and it takes you to the website where you access the training. This is a 90-minute online self-paced training that is very much a skill building training. So when you take the training, you pick different scenarios, and we encourage staff and students to pick the scenarios that are with the students in the context of a school setting. There's 3 of them there. And you get to practice. So there's voice activation where you actually get to practice talking to the student or asking the question, are you thinking of suicide? Whatever the dialogue is, you can do it through voice activation, through typing, practice through what would be texting. And so by the end of the 90 minutes, you've really not only learned about what are the warning signs, how to intervene, but you've also practiced it, which is also great for the students. And so we had a very big launch event across the state with CDE and LivingWorks, and it's on the bottom there. It was a 1-hour recorded event with different various celebrity youth entertainers, and along with hearing different stories from diverse youth who've overcome suicide ideation and their own unique challenges and how they overcame that. So it is something that's available. A lot of high schools are using it to embed in their life skills classes or their health education classes. And they provide it to give context that leads up to the training. So LivingWorks has different resources for teachers and how to integrate the training or the youth summit into the distance learning curriculum, assignments around it, having post discussions around it in the classroom. So there's a lot of tools there for educators as well. So if you click on the bottom link, it takes you to the main site to access the training, the summit, and more information on the training. And then this middle link here takes you right to the training. It says if you're a student, click here. If you're a staff, click here, and then you can start the training. Lastly, students that take this training receive 90 minutes of community service hours, and that's on the certificate there for them. All right, so wanted to just share this infographic. So the training so far has been showing very effective in post-training results. So when you take the training, there's a pre and a post survey that they do. And just to highlight a couple things here, students, after they took the training, 14% strongly agree that it helped them feel confident in their ability to help someone who may have thoughts of suicide. Increased 38% by agree. And then the disagree, we want to see that go down. And it did, it decreased by 15%. With staff, very similar. 36% strongly agree, 10% agree on they feel confident in their ability to help someone, and then decreased by 24%, which is great. So really overcoming a lot of their feelings about not being comfortable addressing it. Now they are. And then over here, you can see the peer support piece. 41% of students already have someone in mind that they want to use their skills with. And then 26% already have someone in mind. So it just shows how widely used this can be once they're trained. And then 99% of students would know how to get help if they were ever struggling themselves after they took the training, and 98% as well. The quotes, love these. These are just samples of many. I appreciated having access to my scenarios as they compelled me to get out of my comfort zone and actually apply what the program is teaching. So that's from a teacher. And then a student says, I finally feel like I know what to do in these sort of situations. So just wanted to share this because the effectiveness of the training, the results are very, very powerful. And the qualitative feedback as well has been very positive. So that's there for you as well. All right, Mara. You're on mute, Mara.
Wow, first I'm choking, then I'm on mute again. just one of those days. I think what was really important for us as we designed this for you was to make sure that you had the resources available to you. And again, we have 55 minutes to get this out. So I think just reminding ourselves what's important, giving you access to everything, and then knowing that you can always contact us to get more information. So here's some tips for supporting students in the pandemic. We are, again, as I mentioned earlier, we're very concerned about what our students are reporting to us, what's going on. We know that child abuse is rising. We know domestic violence in the home is also rising. We also know that students are really staying up and taking care of each other. And so they want the resources, and yet they still, of course, need our counselors to reach out and just let them know that they're there and available. So checking in more frequently with those that have a mental health disorder, whether you know it or not, or just those that you know need that special attention. Monitoring for increased symptoms or changes in behavior, suggesting things that they can do, new routines that they can get. We didn't mention it so much here, but we know that sleep is extremely critical and important, and yet we're having our students more and more on screen, and then they get off screen and they're communicating with their friends via their screens. And so we know there's disruptions in sleep. So making suggestions even about that, about shutting things down, about getting outside, about, just doing something different, because they need that structure. They need more ideas. I have a 16-year-old who will routinely, come in, I'm sick of this, I'm tired of this, I don't want to do this anymore. It's a lot. And so just offering some suggestions. So, he's gotten into different things. He started running, which he didn't do before. He started lifting weights. So we just, whatever we can do to give them new ideas, to get them engaged in something else, then give them ideas just to how to get through the day. We'll share some of the resource that gives a whole bunch of ideas that we can share with our youth. So those are just some of the things that we know are important to supporting our students as while they're in this, well, we're all in this pandemic for sure. So Heather, next slide, please. Are we able to click on these links, Heather? Because we have the time to do so. Perfect. So let's do that. So more resources that we have put together are the comprehensive school suicide prevention in the time of distance learning. So special considerations on that. So if you want to go ahead and click on that, Heather, please.
Yeah, I'll let me click on the prevention checklist because this is just kind of a document with nothing. I mean, there's nothing really to show, but it would be good to look if we can look.
But they'll have access to it anyway, right? Okay, perfect.
Yeah.
Yep.
Hopefully,
I know.
Hopefully you guys can see it.
It did when I went on.
I think I might have to drag it over. Hold on. Because it's on, I have 3 screens. So do you guys see that?
No, we're still seeing the slides. And I don't want you to disrupt that. So it's okay if not. I mean, I think it's okay if not, because I don't want you to disrupt it all.
Okay. I was hoping you guys would see that. All right.
It worked for me when I went on full presentation mode, but I don't know if it's going to work this way. So just again, it's a checklist. It's special considerations to take during the pandemic, also including considerations in the virtual environment. So those will be available to you as well. Heather, next slide, please.
And if could I just say a thing about
please.
The intervention checklist is particularly helpful because what it does is it takes whatever your suicide risk assessment protocols and tools are, it really allows you to kind of align what you have in place and how to adapt it to a virtual setting. And so the same with the prevention checklist. So the checklists work in a way to kind of check off, all right, our current practices have this, but do I have these pieces in place in order to do this in an effective way through a virtual platform? So it's really just taking what you have and making those modifications. Those are particularly helpful, those checklists. Okay.
Perfect.
There we go.
Okay, and then here are some of the most helpful apps that we find when it comes to suicide prevention. The My3 app, it allows you to put in 3 people's numbers that you can reach out to when you might be struggling, just really need to talk to somebody, so they become your favorites. If those 3, you can't reach somebody of those 3, then there's also the number to 911 and then the suicide prevention hotline. So again, very helpful. We have it on our phones and we share it and we talk about it with students and they really appreciate it. So consider sharing this with them. And then the virtual hope box. And in that, there's strategies, there's quotes, there's meditations, and then there's a place where you can put in your own pictures of things that uplift you. So I have pictures of my family, of my kids. And so it's just something that they can tap into that's easily accessible. It's right there on their devices. So consider sharing those with the students, that virtual hope box and the My3 space. I'm sorry, the My3 app. And they are, I'm sorry, I should have mentioned this too. They're also free. So there'd be no cost for them to put these into their devices.
Yeah, and what's great about the My3 app is those 3 people the students choose can also share the safety plan for the student within the app. And there's also coping tools as well in there.
Right. Thanks, Heather. Okay. And then this, we recently just generated this. And if you look at all the resources on there, there's student resources. This is where I talked about the teen guide to mental health and wellness. So there's strategies, there's apps, there's websites that they can access to really support their wellness and their mental health. There's also hotline numbers, so child abuse hotline number, suicide prevention number, of course. And so it's all just in one document. And so because we created so many, the Young Person's Guide to Wellness. So this is more for 3rd grade to 7th grade. It provides also tips and apps and things that they can do. The mental health resources by teens for teens. So as I mentioned earlier, the teens, the youth are really coming up with dynamic and creative resources that they are sharing with each other. And so we hosted those, we put them on our website, and then we just took all of the resources that were created by youth for youth and provided you the link here. So there's blogs and there's posters and there's just a whole host of different things that the teens created. And then the online suicide prevention training for ages 13 and over, which is the Living Works. And then we have staff resources. So we cannot negate everything that our staffs are going through. And as school counselors, many times staff members confide in you and what's happening with them. So really providing resources to them and resources for ourselves just to get through this. It's really difficult times. So all those resources exist there. As well as the parent resources that have been created. So we took everything that we've been working on and creating during this time and put it into one document, and then you will have electronically, you will have the link. So for example, helping vulnerable students feel comfortable while online learning. These are just considerations that when all this started, many of us were not taking. So we wanted to share this with our teachers and get the message out, just take considerations into what's going on with the youth. So that's just a sample of what you see on screen now is a sample of what is available. Do you want to click on any other, Heather, or was that?
No, and then the bottom left is our student staff wellness and positive school climate unit. All of our resources, aside from the ones we created ourselves, are on that link there. So much more for you, but it's a little bit difficult sometimes to navigate the county office websites and where things are with COVID resources. They're on the main page. And so we wanted to just make it easier for everyone to be able to access everything in a one-stop shop flyer.
So go back to that screen though, because we're looking at the handout of helping vulnerable students.
Oh, you are?
Mm-hmm.
Oh, well then that's what happened. Okay. So let me try something. Sorry, guys. So then that's what happened before when you couldn't see the checklist I was bringing up. So let me bring that up. Okay. I'm sorry, I have 3 screens. It's a little tricky.
That's okay.
Okay, can you guys see this now?
Yep.
Yay. Okay, so this is earlier we were trying to show you the prevention checklist. So through distance learning and suicide intervention. So you can see here, it's kind of helpful because it breaks down for you what you might have in place and what you might not, and to be thinking about it. And you can put in your notes here for that as well. So the intervention one looks very similar to this one.
Yeah. Perfect.
Anything else?
Okay.
Yeah. Do you want me to?
No, I think that's it. I think
okay.
The important thing is that they will have links to all this. And so with that, we are 6 minutes early to our time. I don't know if there's any questions.